Oki, and thank you everyone for joining us today. Thank you very much to Elder Clement for not just the prayer this morning, but also for welcoming us to the traditional territory of the Blackfoot. I'm honored to be joined as well by two other special guests who have joined us today. We have Chief Roy Whitney from the Tsuut'ina Nation. Thank you, Chief, for joining us, as well as Chief Ouray Crowfoot from the Siksika Nation. Thank you, Chief, thank you for joining us today. Thank you so much. And welcome as well to Dr. Francois Belanger, the Vice President and Chief Medical Officer of Alberta Health Services. So thank you, Dr. Belanger, for also joining us today. Now, in the past 6 months, they've been extraordinary for our province. The COVID-19 pandemic has changed how we live. It's changed how we work. But it has not changed the mission of the healthcare system here in Alberta, and that's to give every patient the care that they need when they need it. And it's not changed the promises that our government made to Albertans when we ran for office in 2019. We campaigned on strengthening our publicly funded health system. And first and foremost, that means reducing wait times. So we made Albertans a promise. We said we're going to work with our healthcare providers to deliver every scheduled surgery within a clinically acceptable time by 2023. Now, that seems simple. It's only what the system is supposed to do, of course. But it's never been done in Alberta or in any other province. And it's an ambitious goal. It's the centerpiece of our healthcare platform, and it's job one for me as the health minister. It was never going to be easy, and quite frankly, COVID-19 has made the job that much more difficult for us. But I'm here today to say that we're going to keep that promise, pandemic or no pandemic. It's going to take a lot of hard work from our health professionals, and I realize that they're already under incredible stress from the pandemic, and that's not going to be going away anytime soon. But I know that they'll do whatever it takes to do this, because it's not my goal, it's theirs. It's why every surgeon goes to work every day, and why every family doctor, every nurse, every physiotherapist, everyone in the health system works towards the best interests of their patients. They go to work to give every patient the best care that they can, and that means giving that care in a reasonable time. I think surgeons and others are tired of saying we give great care in Canada, but we can't do your surgery for a year. And I know patients are tired of hearing it as well. So let's fix it. And the good news is the work is underway, and we're moving fast, thanks to the leadership of Dr. Belanger and others in AHS, and the hard work of physicians and staff. AHS has already worked through upwards of 90% of the cases that were canceled during the shutdown of non-urgent scheduled surgery in the spring. They're doing over 80% of normal or pre-COVID surgical capacity, and they're continuing to add that capacity back into the system every day. Based on forecasts in other provinces, we initially believed it could take up to 2 years to get there, and that just wasn't acceptable. AHS was able to start offering scheduled surgeries again in May, and they've ramped up steadily since then. By the end of this year, AHS will be providing as many surgeries as they did each month prior to the pandemic. Beginning in the new year, hospitals and publicly funded chartered surgical facilities will keep on increasing the volumes in the province to more than 100% of pre-COVID levels to continue to reduce the wait times here in Alberta. The system will ramp up to at least 125% of pre-pandemic volumes over the first quarter of 2021. We'll reassess as we go, and we'll be prepared to increase volumes to 150% if needed. We'll measure our progress against recommended wait times and keep volumes at the levels needed to reach our goal of 2023. Through the Alberta Surgical Initiative, we'll fund more surgeries across the system. That will include more lower-risk surgeries in rural hospitals across the province and at existing and new chartered surgical facilities under contract with AHS. This work with the chartered surgical facilities is key, since they will have the capacity to do more surgeries at lower cost. Now, I'm eager to hear about innovative projects when AHS posts its request for proposals this fall, seeking operators to expand or to open new facilities in Alberta. We're also going to ensure that First Nations can get involved in this work by providing new grants to 6 First Nations to develop proposals under the RFP. We want to work with any partner who wants to work with us to increase capacity in the publicly funded health system and to reduce costs. This is part of our larger commitment to include First Nations, whether that's in the economic growth of the province or in healthcare. Expanding chartered surgical facilities will also create more capacity in operating rooms in big cities like Edmonton, Calgary, Grand Prairie, and Lethbridge to perform more complex surgeries. The Alberta Surgical Initiative is the most ambitious plan of its kind in Canada. We adapted it to the pandemic, but we didn't change the goal. We're going to recover faster from the pandemic than other provinces. And I'm proud of that, and proud of our health system, because the health system deserves the credit for this. Ontario has indicated that it could take 2 years to clear their backlog of surgeries. BC has ramped up surgeries this summer by running operating rooms on weekends and adding staff, but wait times remain very long. We're leading the way in recovering from COVID, but I'll say it again, just getting back to where we were before is not our goal. We're going to do better, a lot better, and that's going to mean some changes. You'll see more surgeries scheduled in the evenings and weekends, and other process changes like pooled referrals to groups of surgeons and groups of clinics. We'll support clinicians in working to make sure that every patient gets the most appropriate care, not just faster care. So for example, more teams that assess patients and help them choose surgery versus non-surgical care. You'll see construction with $100 million in new investments to renovate and build new operating rooms in hospitals across the province. You'll see more surgeries in chartered surgical facilities as well, at no cost to individual patients. So, most of all, you'll see shorter wait times. Those times will be based on the evidence and clinical standards, mostly 4 months with some exceptions. For example, 6 months for some joint replacements. I said we're going to deliver on that promise in spite of the pandemic. Now, obviously, that does not mean COVID has gone away. It obviously hasn't. We need to continue to focus on keeping each other safe and keeping our healthcare workers safe by keeping the virus out of our hospitals and continuing care facilities and our schools as much as we can. We can do that. We're 6 months into this pandemic. We're not through it, not by a long shot, but we've shown that we can get through it. And we're going to come out of it, not just as we were, but better. I ran for office a year ago to be part of a government that would make this province a better place. Healthcare is incredibly complex. There are 1,000 changes we should make, but ask an average Albertan what we need to do, and it's not complicated. It's simple. Reduce wait times. The commitment I'm giving today is the single most important priority of our healthcare platform. It's the top priority for me as health minister. So I'm honored to be here to make this promise, and I'm looking forward to working with everyone in the system to be able to deliver on it. Now, thank you, and I'll ask Chief Crowfoot to speak on behalf of the Siksika Nation, and then after Chief Crowfoot is able to speak, Chief Whitney from the Tsuut'ina. Thank you.
Okay, Idamik Skanoduni. My name is Chief Ouray Crowfoot, and I'm the Chief of Siksika Nation. First, it's an honor for us to be here in Mokinstis in Calgary, Blackfoot Territory. I'd also like to acknowledge the elder that gave the prayer. Thanks for starting us off this morning. I'd like to acknowledge Tyler White, our CEO for Siksika Health Services, as well as Chief Whitney. He's been doing great things at Tsuut'ina and pushing them through. And all the chiefs, we've all worked together during this pandemic, and the chiefs of Treaty 7 territory. And making it, this pandemic has really shown some areas that highlighted that First Nations have been dealing with for a long time, that the rest of Alberta and the rest of Canada kind of got a highlight of what some of the things we've been dealing with. It's an honor to be here. The Alberta Surgical Wait Time Initiative is a promising venture for Alberta, and it's great news that this initiative is moving forward at this time. We'd like to thank the Alberta Minister of Health, Tyler Shandro, and everyone that's taking part in this initiative. I was invited to give an address today to affirm the importance of First Nation partnerships within an initiative such as this for a number of reasons. Most importantly, because we live in a province where health equity is a priority. However, in the case of Indigenous people here in Alberta, there is much work that needs to be done to improve health outcomes. We are committed as an invested partner in this regard, and we welcome opportunities to participate in leadership and decision-making processes. Secondly, because of the disparity that we continue to see among First Nations people, determinants of health and economic status, such as poverty, employment, education, crowded households, access to health services, food security, social policies, and racial discrimination, continue to impact Indigenous people's health. Thirdly, because First Nations make excellent partners in healthcare, with a focus of providing holistic care and draw from our traditional models of wellness and cultural values to promote strength and resilience for all people. Siksika is located approximately 100 kilometers east of the city of Calgary. We are the second largest nation in Canada from a land-based and one of the largest nations population-based. We have a lengthy history of healthcare within Siksika Nation. In 1924, the Blackfoot Indian Hospital was built and was operated until 1974, when it was shut down and replaced with a clinic that did not have adequate services for our people at the time, and certainly would not have adequate services for people today. The hospital did not just serve Siksika, it served surrounding communities. Our current Siksika Health and Wellness Center was resourced primarily by ourselves, served our people well since 2008 when it was built, offered a wide range of holistic health programs and services. However, our members are required to travel to established hospitals across the province for more complex medical attention, including surgeries. Further, our population is growing and aging will require enhanced community capacity to address healthcare needs. Currently, Siksika Nation has more than 458 seniors and more than 40 that will turn 65 within the next year. According to Stats Canada, Canada's aging population would be most pronounced between 2018 and 2030, a period which all members of the baby boom would reach age 65 or over. According to this, Siksika's elder population could be 50% of its total population by 2030. We are not alone in this. My Indigenous brothers and sisters, along with many other Albertans, experience the same. Initiatives such as the one being discussed today is only one step of many necessary steps towards equitable access to appropriate health care services within responsible timeframes. It is with confidence and gratitude that we will support and participate in the Alberta Surgical Wait Time Initiative, not just for our own people, but for the benefit of all Albertans. By taking part in the opportunities such as this, it gives us tools to move forward with greater confidence. Together, we will accomplish our collective goals of health equity. Thank you.
Thank you very much, Chief Crowfoot. Thank you for joining us today, and thank you for those words. I'd like to now ask Chief Whitney to be able to come and speak on behalf of his nation.
Good morning. Danit Ada. It's an honor to be here. Thank you for the prayer, Clement. It was, our old people always taught us that we pray. When we pray to the Creator for goodness for everyone. Feels good to be on the territory of the Treaty 7 First Nations. And I'm very pleased and honored to be here today, along with my colleague, Chief Crowfoot. And Minister, thank you for inviting us to participate in such an important announcement. Healthcare is a treaty right that was identified when the agreements were made between governments of Great Britain, represented by Canada, as well as our First Nation governments represented by our chiefs. It's a right that we hold sacred to the well-being and the health of our communities. In the 1930s, we had another pandemic. Many of our people during that pandemic lost their lives. I remember the old people saying they were burying 3 or 4 at a time in a day. And we're in another pandemic. And it's an opportunity for us to take advantage of it and look after future generations in the event that this should ever happen again, to safeguard the institutions of our own community, but as well as looking at what is important to our community in the care of our people, both medically as well as holistically. We've had a number of interested parties that want to negotiate and develop a chartered facility, a healthcare facility within our reserve, and it would be adjacent to the lands that our people prayed for and set aside for the well-being of our community along 90th Avenue. And that's the closest hospital to that particular location that's been identified is Rocky View. So I know Rocky View is a backlog of surgical day surgeries that are required within our communities. And our community is part of that process. So I'm very excited and looking forward to developing and participating in the RFP with other groups that may be interested in joining us in opening a chartered facility that will support not only our community, but everyone in its surrounding areas. We're also looking forward to having a discussion with the province on how we address the addictions and alcohol crisis that's within our community. In the last pandemic, it was the pandemic itself that was taking the lives of our people. This pandemic has created a wellness within our communities, and we are now losing a number of our community members whom are young, and that we should be very concerned about and find ways to ensure that we have availability for them to be able to look forward to well-being of their communities, to assist them if there's addictions that are there that will help our community in dealing with the crisis. The crisis is all over in First Nations. It's not just ours. All the First Nations of Treaty 7 have faced the difficulties and the challenges around the pandemic with the crisis of alcohol and substance abuse. So as chief and with the council, we're taking steps with this new initiative as well to look not only at the surgical units, but how we work with the province to help support our community members to some time of treatment, aftercare facility. This medical campus that we're looking at off 90th Avenue is an opportunity to build it and allow our young people to become doctors, registered RN nurses, facility healthcare workers, and that's who they are. That's who we are. We're spiritual to the land. We're spiritual to the well-being of our communities and our own selves. So it's a great opportunity, and I thank the government, the provincial government, and Minister Shandro for inviting us here today and asking us to participate in this exciting adventure. Thank you. Thank you, Chief.
Thank you, Chief, for those words and for joining us today, and as well for reminding us this isn't just about surgical capacity in the province, but also about the opportunities for folks in your communities to be able to, as you said, to be able to learn and to enter into these professions and be included in the healthcare system. So thank you. I'd like to now ask Dr. Francois Belanger, Vice President and Chief Medical Officer of Alberta Health Services, to be able to come up and to give a few words. Doctor?
Good morning, everyone, and thank you, Minister Shandro, for inviting me to join today. It's my pleasure to be here today to talk about the work we are and will continue to do in partnership with Alberta Health to improve the wait times of Albertans waiting for surgical procedures in our province. As Minister Shandro mentioned, on March 18th, we temporarily postponed non-urgent scheduled surgeries to ensure we had capacity to respond to Albertans' healthcare needs during the pandemic. While surgical activity was reduced by 60% initially, AHS continued to provide urgent and emergent surgeries to patients and Albertans, Albertans continued to receive the life-saving surgeries they needed when they needed them. On May 4th, as our hospital capacity increased, we resumed some scheduled surgery activity in all zones across the province. During the first few weeks of resumption, our teams rapidly adapted to the increasing surgical volumes while still ensuring patient and staff safety during the pandemic. And in the first 6 weeks of resumption, we focused on day surgeries and chartered surgical facility procedures. The resumption was a significant effort as the process for surgery for patients, staff, and physicians has changed considerably, including new workflows, new requirements for public health measures, and new challenges when operating on COVID patients. Some examples of this work include new policies and protocols, support for safe patient transfer before and after surgery, screening pre-surgery and enhanced isolation protocols, additional protocols for enhanced cleaning, and workflow changes, including physical distancing in recovery room areas. The time and dedicated work AHS staff and physicians put into to adjust to new work processes and patient flow to keep patients and staff safe was absolutely tremendous. We had no major outbreaks in the first 6 weeks of resumption in AHS or chartered surgical facilities, and the rates of healthcare worker infection remained very low, lower than the national average. The surgical recovery plan recognizes the need to maintain adaptability and flexibility across the province to make sure we have the capability and resources required to respond to Albertans requiring surgery and preventing the spread of COVID. As such, our plans need to include measures to balance this response, but also continue to provide consistent quality surgical care to Albertans. We will ensure necessary beds and staff are in place for the COVID response. Safety of patients and the safety of our staff and physicians remain the utmost priority. Any increases in surgery activity will happen providing it is safe and appropriate to do so. We are increasing surgical volumes in rural areas as part of our overall strategy to reduce wait times. We have implemented a number of strategies across the province and in each zone to support this increased activity, including extending operating room hours on evenings and weekends for urgent surgeries, thereby improving access to meet the demand of urgent surgeries and for increased scheduled surgeries during weekdays. Increasing capacity at our chartered surgical facilities through increasing activities for non-urgent surgeries like cataracts and retinal procedures. AHS will also begin training operating room staff to support planning to increase overall surgical activity. Following this surgical recovery plan, we will move fully into the Alberta Surgical Wait Time Initiative Plan, which will have us continue to decrease wait lists so no patient is waiting longer than what is clinically recommended. We are grateful for the patience of all Albertans who had their surgeries delays as we took and continue to take necessary steps to ensure our healthcare system is prepared to respond to COVID. We recognize that having surgeries near home is important to Albertans to help them recover in their communities with their families and their loved ones. Working in partnership with Alberta Health, with this surgical recovery plan, we are moving towards making sure patients and families will receive the surgery they need when they need it according to the clinical appropriate targets. This partnership with Alberta Health will help us achieve our goals to provide more surgeries for Albertans and maintain high-quality care. I would like to thank all of the team at AHS, all the different teams at AHS, who are working together with physicians to make this happen. We value all of you and your dedication to Albertans. Thank you again for having me today, Minister.
Thanks, Dr. Belanger, Minister, and our two special guests. So we'll take media questions now. I think we have several on the line. So first question, please.
Our first question comes from Jesse Weisner of the Globe and Mail. Your line is open. Hi. Thank you for taking my question. This is for the health minister. How will doctors be recruited to these new chartered health facilities in the short term, as some have been moving to other provinces? And will the demand for physicians in these facilities put a strain on the public health system?
Well, so the chartered surgical facilities, we have 43 of them right now in Alberta. And so what happens right now is there's a contract with AHS. They're managed by AHS under contract. They're integrated in the system. They're not parallel to the system. They're integrated in the system. So we have right now 10,800 physicians who work in Alberta. And where the physicians decide to have the surgery is up to the physician. It's not up to the patient. So it's not necessarily a matter of the chartered surgical facility recruiting a physician. It's about the facilities, whether it's an AHS-owned and operated facility or an independently owned and operated facility, to be available to the physicians for the physicians to know that there's going to be opportunity there. Now, many of our surgeons for years have let us know that they don't have the access to operating rooms that they'd like to have access to. That many times they see their wait lists grow and grow, because we don't have the capacity in the system to have them have access to those operating rooms so they can get the surgeries done in those operating rooms for their patients. That's the issue. And so, look, I'll also say this. There's a bit of a premise in your question there that's got to be corrected. We are continuing to see physicians, and the number of physicians in Alberta continue to increase. For example, over the last year, we've continued to see physicians do come and go from Alberta. I think there's about 290-something physicians who did leave the province in the last year, but we also saw over 600 physicians come to Alberta because they see this as a great opportunity for them to be able to provide care to patients here in Alberta and them to make a living for them and their families.
Thanks. Follow-up?
Yeah, follow-up question?
No, thank you.
Thank you.
Thanks. So we'll take the next one.
Our next question comes from Bill Fortier of CTV. Your line is open.
Hey, Bill.
Well, hi there. One clarification I'm looking for first. Is a chartered surgical facility the same as a surgical contract facility, the ones listed on the AHS website? Is that the same thing?
Francois is telling me yes. It is. That's the same thing they're talking about on that website. We used to refer to them in the system as non-hospital surgical facilities, and so that may have been how they disclose it on the website.
Understood. Thank you. And for the minister, then you mentioned there are 43 of these right now. How many do you expect there will be once this initiative is fully enforced? And how will it work in terms of this request for proposals? Will these chartered facilities pay their own money to expand or build new ones? Or will they be looking for public money? Will that be part of the proposals that the province will put in some money to help them build these facilities or expand these facilities?
So you're right. There's 43 of them right now. They do about 15% of the 285,000 surgeries that we do in Alberta in a given year. They do about 15% right now. I hope I'm not forgetting a question in there, but I think then you were asking about how many more we're going to see. We don't know. Quite frankly, that's why we're going to a request for proposals, because we're going to see then who the proponents are who make these submissions. We have developed, as a result of one of the recommendations of the EY report for the AHS performance review, one of the recommendations is that there be a secretariat, which we've called the Health Contracting Secretariat, which is set up under the ministry for them to be able to assist AHS in being able to attract new proponents, but also to be able to provide that expertise to AHS on how the contracts for these should be set up in the future so that they're sustainable and that these folks have that predictability and stability to knowing that they want to make those investments. Which leads to your last question. No, the contracts don't provide capital funds for building these new facilities. It's a contract to be able to provide a facility fee. So every surgery done in these facilities, there would be still 3 fees. And which would be the same as an AHS, a surgery done in an AHS facility, but there's a fee, surgeon fee that's paid by the ministry to the surgeon, and an anesthetist fee that's paid by the anesthesiologist to be able to be there for the surgery, as well as a facility fee. Now, AHS, it just happens to be that's part of the $12 billion grant that we give to AHS. But AHS with these contracts would be paying these facilities a facility fee for them to be able to do each of these surgeries. Follow-up question?
I think that was the follow, so I think we'll move to the next one.
Okay.
Our next question comes from Mirna Zuzkic of Radio Canada. Your line is open.
Thank you. My question is for the minister. The initial goal was to reduce the number of people waiting more than 3 months by 75% before the end of your term, if I'm correct. Regarding, we were kind of a little bit back where we started because of the pandemic. Is that goal still attainable?
These goals are attainable. Right now, I think we're about 80-something% of our pre-COVID capacity for the whole province throughout AHS. That's been work that's started. I should also say this. Look, during when we were at the height of the pandemic, before May 4th, surgery still occurred. We were down to about 40% of our pre-COVID surgical capacity. There were surgeries still being done. The emergency and urgent ones and cancer-related surgeries were still being done. Once May 4th came along and we started starting back up the non-urgent surgeries, since then we've gotten to over 80% of our pre-COVID capacity. We're going to, I think, for all the folks that were added on to the wait list, we, before COVID, probably had about 68,000 people who were on that waiting list. That grew to about, I think as of today, about 75,500 people. But the people who were added on to the wait list before May 4th, I think we've gotten to about 88% of those folks who had to have those surgeries postponed. Obviously, the day surgeries are going to be a lot quicker and easier for us to get through. But the hard part is, and for people, including patients, to understand that the difficulty is that COVID has not left us. It means that every surgery takes a little bit longer to do. So that's one of the difficulties in us to be able to get through and meet the targets that we committed to Albertans in the campaign.
Thanks. Follow-up?
You just talked about 43 chartered surgical facilities that are currently under contract with AHS. Is there a plan to increase those 43, and to how many would you like to get?
Well, we have announced that we will be issuing a request for proposals for folks to be able to make a submission if they would like to open a chartered surgical facility. So we'll see if people do submit. I know that at least the 6 First Nation communities whom we're providing this grant that we're announcing today will be interested in submitting to that RFP so that they might be considered for surgical facilities that would be owned and operated by them. So we know at least those 6 will be making submissions.
Thanks for that. So we'll move to the next question.
Our next question comes from Tim Brooke of CTV. Your line is open.
Hey, Tim.
Hey, this is for the minister. Just a really quick one. You talked about ramping up surgical volume towards the end of the year up to 100%. Where does the second wave factor into this? If things do get bad again with COVID, are you more or less saying we're not going to slow down surgeries again, or is there some kind of plan that maybe I'm not aware of?
Well, we do know that is a risk. How we're mitigating that risk is obviously by continuing to monitor and continuing to invest in our testing and contact tracing to make sure that our acute care system does not become overwhelmed with second and our future waves of COVID. We do know that right now COVID is still affecting us to the extent that every surgery takes longer to do. That's the unfortunate reality of this. Because of our infection and prevention control, infection prevention and control, that surgeries are taking longer, so it's making it more difficult to meet these targets. And as we see, you're right. If we ever did see an outbreak at a certain facility, that could also mean it makes it more difficult for us to meet these targets. But we are committed, along with our partners at AHS, to be able to do our best to make sure that we're doing everything to meet the commitments that we made to Albertans, and we're going to be meeting those commitments by 2023. That was your first question. Was there a follow-up, Tim?
Yeah, not to drive the point home too much, but you did say there's 43 current facilities, and you guys are going to put out an RFP. Can you give me maybe a ballpark about how much response the province expects to have with this? Can you maybe say, there's going to be a dozen of these things, or you can just say, there's the 6 First Nations, and from there it's kind of unpredictable?
We really don't know. We really, truly don't know, because we haven't even issued it yet. And so it's going to wait to see who actually does make submissions in the end. But we know that the 6 First Nations communities will be making those submissions, I believe, as a result of this grant that we're providing them to be able to do the work to make sure that their submissions, they can understand what surgeries might have the opportunities to be provided in those communities. So we know about those 6, and I think we have to, because we haven't done this, an open call for submissions like this. So we really don't know what the appetite's going to be for proponents to make these submissions.
Okay, thanks, Tim. Next question.
Our next question comes from Safe Kaiser of 660 News. Your line is open.
Hey, Safe.
Good morning. My question for the minister. So the AMA says they're okay with the sunshine list, but with Dr. Billing's about to be made public now, what I'm hearing from a couple of doctors is the fact that they feel the list might not give enough context to some costs that they have to cover, like overhead. What do you have to say about that?
Oh, well, thanks for the question. Look, I would say this. Right now, physicians are the only vendors to government whose gross billings are not disclosed to the public. Whether it's, Ernst & Young, who provided us with the report that they did of the AHS review, to, if you're a roofing company and provide services to the Minister of Infrastructure, let's use that roofing company as an example. Your gross billings are disclosed. The gross amount that you are paid by government is disclosed. Now, what you as the owner or president are paid as a salary or pay yourself in dividends, that's not disclosed. Now, if a physician wants to post their own, for further context, post on their own website, what their expenses are, I leave that for those physicians to do. But look, this is going to be the most comprehensive disclosure of its kind in Canada. We're also going to give the context of the number of days worked, the number of unique patients that are on the patient roster, as it were, and I think that's going to give fantastic context to Albertans, because it is going to be the most comprehensive. And let's remember this as well, that this is 10%, not of the health budget, 10% of the entire budget of the government of Alberta, and it's paid to 10,800 folks. And I think Albertans deserve to know this information. And quite frankly, this is exactly what was asked for by physicians, including the AMA. When we go back to August, and last August, 2 Augusts ago, when the McKinnon panel's report was tabled, the AMA, I think, expressed concern that the McKinnon panel and government were relying on CIHI data, the Canadian Institute of Health Information. So look, we're addressing that concern by making sure we're providing better disclosure and more transparency. And if physicians want to be able to disclose more information on their own websites, I leave it for them to do that.
Okay. Thanks. Next question.
Our next question comes from Ashley Joanno of Post Media. Your line is open.
Ashley.
Good morning. I wanted to give the minister a chance to respond to the Canby Health ruling in BC with regards to private health care, and whether you think the decision by the court there changes any of your plans for healthcare reform related to opening these facilities or the privatization of community labs, that kind of thing.
Well, first of all, let me say this. It doesn't change these plans at all, because it has nothing to do with what we're announcing today. These are surgeries that are 100% paid for publicly. The Canby litigation had to do with surgeries that are privately financed. That has nothing to do with what's being discussed today. So it doesn't change these plans at all. These are surgeries that are managed by AHS under contract, integrated in the system, not parallel, integrated in the system. The work that's done in these facilities is also under the jurisdiction of the College of Physicians and Surgeons to make sure that the work that's done in these facilities is done safely. I quite frankly have not read the Canby decision, take no position on it, but it definitely does not make any changes to these plans because it has nothing to do with what we're talking about today. Any follow-up, Ashley?
Yeah, there has been some concern about catching up on the backlog of surgeries contributing to capacity issues at the ICU, among other things. And I'm wondering if the plan for increasing surgeries also includes plans to increase ICU staffing or size.
Sorry, maybe say that last sentence again, whether it would...
I just wonder if you're planning on increasing the amount of surgeries that are being done to
in
catch up
AHS?
with the backlog, are you also planning on increasing ICU size or staffing or that kind of thing?
Well, I'll remind you of our announcement in February where we announced $100 million in capital to AHS to be able to increase and invest in those publicly owned AHS facilities, those operating rooms there, as well as I think part of the plan is, and maybe Dr. Belanger can correct me if I'm wrong, but I think part of it also is to consider our ICU beds as well, because after, as you point out, after somebody gets a surgery, inpatient surgery, they have to then go into a bed in that hospital. So that is part of the plan of how we're going to be spending that $100 million, because we need not just to, the CSFs, the chartered surgical facilities, are just a part of our surgical initiative. We also have to increase the number of surgeries that are done in AHS facilities. That includes being able to invest with this $100 million in these operating rooms and elsewhere in the facilities, making sure that we're investing in not just hospitals in the major urbans and mid-sized urbans, but also in hospitals like Olds, where we need more surgeries being able to be done in those facilities. And we're going to continue to invest in those facilities because we need more capacity in the AHS operating rooms as well. And making sure that, like it's happening right now, before COVID, surgeries were starting at 7:30 and starting to wind down, around 2:30, 3 o'clock, and definitely being done by 3:30. Now, AHS, to catch up on this backlog, is also doing surgeries in the evenings and weekends, which is remarkable, an incredibly difficult task. But Dr. Belanger, if you want to add any context to this?
Yeah, just to answer the questions, our plan includes the whole surgical journey, and that would include from the time that it's determined somebody needs surgery, that would include preoperative care, the actual operative care, and the postoperative care. So it's the complete surgical journey. Thank you.
Good, thanks. And I'm sorry to Safe Kaiser, who I think is still on the line. I think we missed a follow-up from you. So if you're still there, we'll go back to you, please.
Sorry about that, Safe.
No worries. I was wondering, Minister Shandro, and thanks, Steve. I'm having a hell of a time getting AHS to talk to me about this, but several homeless shelters, a couple in Calgary, got outbreaks confirmed. I was just wondering what's happening there. Are there any extra funds, support, manpower from your department to help them? And why is it so hard to get confirmation from AHS when there's specifically an outbreak at a shelter?
Well, that actually might be the Emergency Operations Center in our ministry and Dr. Hinshaw's office. So that may, in defense of AHS, that might be the context. So we'll endeavor to make sure you get all your questions answered related to those outbreaks. But related to what's happening right now and further resources, of course, AHS and Dr. Hinshaw's office do work very closely with any outbreak situation to be able to work and make sure that they're working with the people on the ground there in those outbreaks, whether it's a shelter or otherwise, any kind of outbreak, to make sure that they understand how transmission happened in that facility or in that workplace. What further could be done related to our guidelines and whether anything should be changed. If those folks are following the guidelines, and if not, working with them to make sure that they are, But Dr. Belanger, if you want to provide any context, is that something you could answer, or should we follow up afterwards? We'll follow up afterwards.
We'll follow up afterward and make sure that we're clear what outbreaks we're talking about and get them reported accurately.
That's okay. We'll make sure that the question's answered for you, though. But I don't think that's an AHS issue. I think that's us safe. So I'll own that and get you that information.
Thanks. So we'll move on to the next one.
Our next question comes from Bill Fortier, CTV News. Your line is open.
Oh, hi. A quick question for both chiefs, if you could. I'm wondering what you expect from what you've seen so far. The cost will be to your First Nation to have these facilities potentially set up on site.
Chief Whitney.
We've been in discussions with existing charter facilities that may want to expand and work together in developing an infrastructure that would complement the cost as well as the ability to facilitate those kind of day surgeries that are required. So as the negotiations proceed, that it will be identified in the RFP that will be submitted towards to the minister's office. But that's how we're looking at it at this point in time, and we haven't put together all of the costs. Obviously, this is just a new initiative, but we're looking at, we want to be creative, we want to think outside of the box, but we also want to be respectful to the health. So I appreciate the question. Does that answer your question?
Somewhat, yes.
Okay.
And a quick follow-up, if I could. For the minister or Dr. Belanger, I just want to be clear. So going from 100% of surgeries to 150% by 2023, will that 50% jump be all chartered facilities, or will some of it still be within the publicly operated system?
Sorry, Bill, we'll hold that just for a moment. I think Chief Crowfoot wanted to add a few words.
Yeah, similar to my colleague Chief Whitney said, this actually comes at a good time because Siksika, we've already been looking at this before this initiative came forward. So like I said, we had a hospital on Siksika, back in the early 1900s. So, we've been looking at initiatives and joint ventures, and we've had these business plans for some time now on how we can move forward with a surgical facility. So, like I said, we'll put all those plans together. We've done a lot of the analysis, and, this is something that Siksika has been looking forward to for a long time. Like at Siksika, we have about 8,000 band members, about 3,500 live on, about 4,000 live on Nation, and approximately 3,000 or so live in the Calgary area. So, and then also, like I said, at Siksika, if we put it at Siksika, if we put it in Calgary, we would be also servicing the surrounding areas. There's a lot of areas that come to. We don't just focus on Siksika at our current health center. A lot of the surrounding communities, that's who we would also service. So that's kind of been in our business plans for some time now. So just want to address that. Thank you.
Thanks, Chief Crowfoot. So, Bill, I'll ask you to repeat the next question, please. And just by the way, that'll be our last. Bill, you're the last in the queue, so this will be it.
Sure. Thank you very much, and sorry for the interruption, Chief Crowfoot there. That was my fault. I want to confirm, so going from 100%, the current capacity, or, when we get current capacity by the end of the year, to 150%, I want to confirm, is the plan to do that entire jump of 50% through these chartered facilities, or will there also be some expansion of the publicly operated surgical facilities?
Well, no, it's the latter. No, it's definitely not all going to be in charter surgical facilities. We do know that a part of it has to be expanding the number of surgeries that are done in the existing 43, and there will be opportunities if there are other CSFs who do come online and enter into a contract with AHS, but most of this is going to fall onto AHS's shoulders themselves, and doing things that, like the innovation and having, which is incredibly difficult for them to be able to do and execute, but having the evenings and weekend surgeries, With the $100 million, as I mentioned earlier, that we are investing in AHS facilities to be able to increase that capacity in those facilities, a lot of it has to be, for example, increasing the capacity in some of those operating rooms themselves so they can do more complex surgery. So a lot of it has to do with AHS. It's going to fall on most of it on their shoulders, unfortunately, but they're up to the task, and we look forward to working with them to make sure that we can meet these commitments.
Any follow, Bill? Well, I don't know if we've lost Bill, but I think he was the last on the line. So with that, we'll wrap up. Thanks, Minister Shandro. Thanks, Dr. Belanger. Thanks very much, Chief Whitney and Chief Crowfoot.
Okay, thank you, everyone.